Hi, I'm Dr. Roger Tsai, and welcome to my office. Today, I want to speak about what to expect during a rhinoplasty consultation. So oftentimes patients come in for various different reasons. The two main reasons are a functional aspect and the cosmetic aspect of the nose. So from a functional standpoint, some patients come in with a deviated septum and have difficulty breathing. The way we fix that is to straighten the septum in something called a septoplasty. Sometimes we take out the turbinates, which are three large structures that are there in our noses to help warm up the air as we breathe. There's three of them on each side, so we can remove the inferior or the lower ones, and oftentimes you feel those when you're sick. When you sleep one way, they kind of blow up. When you sleep the other way, they blow up. Those aren't necessarily needed, and they take up about 50% of the airway. So by removing the turbinates, oftentimes your breathing will automatically be twice as better. Again, along with that, we can straighten the septum to not only improve airway breathing, but also airway space. So that's the functional aspect of a rhinoplasty. When it comes to the cosmetic aspect of rhinoplasties, patients come in with, again, many different types of issues. So the first question I like to ask patients when they come in is, what is it about the nose that they don't like, or what is it that I can help improve for them? One important thing to understand when it comes to rhinoplasty procedures is to make sure that the patient is old enough and has finished puberty. This usually happens around 16, 17 years old for women and about 17 to 18 years old for men. So it's important that the patients have reached this time in their lives before proceeding with an rhinoplasty surgery. So when it comes to the cosmetic aspect of the nose, there's a few things that patients oftentimes complain about or would like changed. I oftentimes tell patients, we look at the mirror together, go through each aspect of the nose. And we take a look at the nose from the front view and we take a nose from the side view. So from the front view, oftentimes patients complain about the width of the bridge, the width of the nose, and sometimes the width of the nostrils. So for the width of the bridge, what we can do is we can break the bones and narrow the bridge here to give patients oftentimes more of a narrower contour, and what I like to call these reverse parentheses, where it goes kind of in and out like this. That's a very aesthetically pleasing and looking nose. Oftentimes the tip is very bulbous. So for patients who have a wide or bulbous tip, we can shave down the cartilage to give them a more improved contour and appearance. Lastly, oftentimes patients have very wide nostrils, especially with ethnic patients, and we can perform weir excisions or nostril reductions to narrow the width of the nostrils. It is important to also understand that patients sometimes have thin skin and patients oftentimes have thicker skin. Everybody's a little different, and depending on the skin texture and quality will also determine at the end of the day the amount of change of the nose. For example, I always like to tell patients the difference between placing a bed sheet over a chair versus a comforter over a chair. If you put a bed sheet over a chair, you can see the armrest, the back, the legs, the seat. You throw a comforter over the same chair, and oftentimes it looks like a big blob. So for thicker skinned patients, oftentimes you see less of a change, and thinner skinned patients, you oftentimes see more of a change. But regardless, we can review this during the consultation, and during the consultation we will review what can be done, what can't be done, and the expectations of what each patient can perceive. From the side view, oftentimes patients have a bump or sometimes even a hump, and the tip sometimes comes down or droops as well. Sometimes the septum also falls a little bit low as well. So in situations like this, whether it's a bump or a hump, I would like to shave down the bump, and the bump oftentimes is made up of the bone and the cartilage in the area. So with the bone, we rasp it down with basically a almost metal sandpaper looking like device, and that will shave the bump of the bone part down. The cartilaginous portion of the bump we oftentimes cut with the scissors. So there's oftentimes two components to the bump that's involved on the bridge of the nose. For a feminine nose, I oftentimes like to give a little bit of a curve, not a big scoop, but a little hint of a curve. For men, sometimes they like it straight, or maybe even, again, a slight hint of a curve. So that's the changes for the bridge. All right, so now let's talk about the tip of the nose from the side view. So just like with the front, when we remove the excess of cartilage, that will not only thin out a tip, but it'll help also improve the contour from the side. For a feminine nose, the ideal angle of the nose going upwards is about 110 degrees. For men, it's about 100 degrees. So for females, I oftentimes like to give a little hint of a curve and the tip kind of pointing and popping up. Not a big nose, but just a little bit upwards. And for men, oftentimes they like the straight nose and the kind of nose going straight forward. So again, this is going to be reviewed during the consultation, and the degree or angle of how high the tip goes will be determined at that time. Oftentimes, the septum, which is the center part of this nose here, also hangs, which you can see from the side view or the profile view, and we would need to remove the bottom part of the septum in order to keep it in line with the rest of the nostrils. Is that the nose is too projected or it sticks out too much. So again, when it comes to the bridge portion, we can shave that down, trim off the cartilage, but sometimes the nostrils, we need to do an extra step called nostril reduction, where we make little incisions on the side and remove part of the nostrils so that the nostrils come closer to the face. So instead of being very long, we can shorten the length of the nostrils. Again, this will all be discussed during the consultation process. As far as how I perform the procedure, all my rhinoplasties are done in a closed fashion. You oftentimes hear this as a scarless rhinoplasty as well. These, I literally peel the nostrils inside out and make the incisions inside the nostrils so there's no external cuts. Oftentimes you see the external cut here at the bottom of the septum. That is what we call an open rhinoplasty. So that's an open rhinoplasty versus what I perform, which is a closed rhinoplasty or a scarless rhinoplasty. As far as going through recovery, after the surgery, a splint is placed on the outside of the nose. It's a metal splint that stays there for 1 week. It's almost like when you break your wrist or break your arm or break your leg, you're in a cast for a certain amount of time. So when the splint is on the nose, it stays there for 1 week. At the 1 week mark, we take the splint off, and the two things we look out for are bruising and swelling. The bruising will last anywhere from 2 to 4 weeks, and that just depends on how easily you bruise. If you're an easy bruiser, closer to 4 weeks. If you're not an easy bruiser, closer to 2 weeks. Arnica will help quicken the process of the bruising. As far as swelling goes, I always tell patients, you gotta give me a solid month to be what I like to call presentable. When I mean presentable, that means being able to go out in public, going to the grocery store, hanging out with your friends, going to the movie theaters, going to the restaurants, and not feeling self-conscious. Once the splint comes off at a week, you can definitely do these normal activities. It's just you don't look the part, you're very bruised, you're very swollen, the nose looks a little bit funny, and so you might be a little self-conscious doing these activities. But as long as you give me a solid month, you'll be able to go out and do these activities without feeling self-conscious. I oftentimes tell patients as well that when a splint comes off, there's a little bit of a shock factor. The reason for that is the nose is performed in a way where it's a little bit exaggerated. The reason we over-exaggerate certain aspects is because we know everything's going to settle. For example, during the swelling process, the nose will expand. So on purpose, we really narrow down the nose as much as we can, knowing that it's going to expand over time. Additionally, the tip of the nose is also a little bit higher in the beginning because we know over time that will fall. So again, the nose will be a little bit higher and the nose will be a little bit more tighter and smaller because we know that over time during the healing process, everything's going to expand. If we don't over-exaggerate some of these features, then oftentimes you won't get the results that you're looking for. So again, there's oftentimes a little bit of a shock factor in the beginning because the nose looks a little bit funny, not necessarily bad, and you see all the major architectural changes right away. Again, narrowing of the bridge, narrowing of the tip, giving you a nice little curve, elevating the tip. That you will see right away. It just looks a little bit funny in the beginning. At the same time, the face is also very bruised and very swollen, so you look a little different and don't look like yourself. But again, once we hit about the 1 month mark, patients are oftentimes very happy with their nose and they're able to go back to doing all their activities. Moving forward, swelling does last 6 to 12 months, so do realize that it can take some time for all those swelling to fully subside. Again, it only looks a little bit funny and awkward during that first month. For the rest of the time, it's almost like watching grass grow. As each month progresses, you'll notice a little change here and there. It'll start looking more natural. So these are some of the main topics and subjects that we reviewed during the consultation process. Obviously, every single patient is unique and we tailor the surgery to every single patient individually. So there will be some specifics that we will review and discuss that we're not talking about in this video during the consultation process, depending on every individual patient's goals and aspirations. Thank you for watching this video. If you have any questions, please feel free to reach out to our office. Also, please follow us on all our social media platforms at Dr. Roger Tsai and leave a comment below and tell us what you think.